If your knee pain is starting to control your life, whether it's stopping you from walking, exercise, or even sleeping, you've probably heard about knee replacement surgery. It sounds like a big step, and it is. In today's video, I'm going to tell you what I think are the 5 most important things every patient should know before having a knee replacement surgery. And these are things that most people are not aware of. Hi, my name is Dr. Marc Gruner, and I'm a board-certified sports medicine doctor. Knee replacement is typically recommended when pain and stiffness significantly affects your quality of life and when conservative treatments like physical therapy, injections, or medications are no longer working. Waiting too long, if you really need a knee replacement, can actually make recovery harder. But doing it too early can mean that you have rushed to the decision to be really challenging for most patients. So how do you find that balance? That is exactly what we are going to break down. The first of the 5 things that you need to know about knee replacement surgery is the average age. Most people are surprised to learn that the average age for knee replacement is around 65 to 70 years old. That said, this number is slowly trending downward. Why? Because people are staying active longer. They want to hike, travel, and stay independent well into their later years. At the same time, improved surgical techniques and better implants have made outcomes more predictable. That does not mean younger patients do not get knee replacements. Patients in their 50s and sometimes even their 40s may be candidates, especially if they have severe arthritis or prior injuries. But there's a trade-off. Knee replacements do not last forever. Most modern implants last about 15 to 20 years, sometimes longer. So if you get one too early, you may need a revision surgery later, which is often more complex than the first procedure. A key question that most people do not ask: are you trying to delay the surgery or are you trying to maximize your long-term outcome? Those are not always the same thing. The second thing to know is the reason behind knee replacements. The most common reason people need a knee replacement is osteoarthritis, but not all knee pain leads to surgery. This is the wear and tear type of arthritis where the cartilage in your knee gradually breaks down over time. As the cartilage wears away, bones start to rub against each other. That leads to pain, swelling, stiffness, and eventually reduced mobility. Other causes include rheumatoid arthritis, post-traumatic arthritis after injuries like ACL tears or fractures, and less commonly conditions like avascular necrosis. But here's the most important thing: not all arthritis requires surgery. Many people live with arthritis for years, starting in their 30s to 40s, and manage it well with non-surgical treatments. These include physical therapy, weight management, activity modifications, anti-inflammatory medications, and injections like cortisone injections, hyaluronic acid injections. There are newer injections like PRP, which is called platelet-rich plasma, or stem cell injections. There are even newer treatments coming to the market. The decision for surgery is not based on an X-ray alone. It is based on how much your symptoms are affecting your daily life. So if your knee hurts, but you can still do most of what you do, surgery may not be the right next step, at least not yet. The third thing to know about knee replacements is about the recovery after the surgery. One of the biggest misconceptions about knee replacements is how quickly you will bounce back. Yes, many patients walk the same day or the day after surgery, but that does not mean you are back to normal. The first 2 to 4 weeks are usually the most challenging. Pain, swelling, and stiffness are common, and physical therapy is essential during that time. You are essentially retraining your knee to move again. By about 6 weeks, most patients are moving comfortably and can handle basic daily activities. By 3 months, many people feel significantly better, but full recovery can take 6 months to a year. Most people can't return to running or very intense activities. That timeline surprises a lot of people. Here's the key insight: the surgery is only part of the process. Your outcome depends heavily on your commitment to rehab. The patients who do best are the ones who stay consistent with physical therapy, even when it's uncomfortable. So before you commit to surgery, ask yourself this: are you ready for recovery, not just the procedure? The fourth of the 5 things to know is that while modern knee replacements work well, they are not the same as your natural knee, and not everyone is pleased with that result. Knee replacement surgery has come a long way. Today, over 90% of patients experience significant pain relief and improved function after surgery. That is the good news. But here's what patients often misunderstood: a replaced knee does not feel exactly like a natural knee. Not everyone is happy after a knee replacement. Some patients notice a difference in how the joint moves. Others feel mild stiffness or a mechanical sensation. High impact activities like running or jumping are discouraged to protect the implant. And for some patients, knee pain does not always go away after the knee replacement surgery. While about 80 to 90% of patients have good pain relief and better function, around 12 to 22% still report pain 1 year later. About 20 to 25% of people say they're actually not fully satisfied with the results. The goal of knee replacement is not to give you a perfect knee. It's to give you a functional, pain-free knee that allows you to return to everyday activities. Walking, golfing, even light hiking are very achievable after recovery. If your expectation is to return to intense sport at the same level as before, that is something you need to discuss carefully with your surgeon. Finally, the last and most important thing to know is that there are real risks to surgery, but for the right patient, the benefits often outweigh them. Like any surgery, knee replacement comes with risk. These include infection, blood clots, implant loosening, stiffness, and in rare cases, nerve or blood vessel injury. That said, serious complications are relatively uncommon. For most patients, the biggest risk is not the surgical complication, it is getting the outcome they expected. This often comes down to expectations, rehab effort, or underlying health conditions. The patients who do the best are typically those who are medically optimized before surgery. That means controlling conditions like diabetes, quit smoking, maintaining a healthy body weight. So how do you know if you actually are ready for a knee replacement? If your knee pain is limiting your daily life, if conservative treatments are no longer working, and if you understand the recovery and expectation, then it may be time to seriously consider it. But this decision should never feel rushed. It should be a thoughtful conversation between you and your surgeon, weighing your symptoms, your lifestyle, and your long-term goals. At the end of the day, knee replacements is not just about fixing a joint. It's about getting your life back. And if you are still exploring options, there are other treatments you should understand before making this decision. Knee replacements is not the only option. Treatments like gel injections and platelet-rich plasma or PRP or stem cells are often used early in the process. PRP in particular has gained a lot of attention for its potential to reduce pain and improve function in certain patients with knee arthritis. If you want a full breakdown of PRP, what it is, who it works for, whether it is actually worth it, we have another video on the channel that goes into detail. Before you commit to surgery, it is very important that you understand every option available to you. What questions do you have? Drop them in the comments below and I'll do my best to answer them in a future video. Remember, hit the like and subscribe, and I'll see you in the next one.